see the definition. It is the most dilated part of the digestive tube which conveys food from esophagus to duodenum. It is J-shaped. Its average capacity is 1.5 liter. In neonates, it's 150 ml. Situation: it is in left hypochondrium mainly, extended to epigastric and umbilical region. It may be asthenic, hyposthenic, sthenic, or hypersthenic. The four types. Here you can see this is the stomach. Inside the parts, let's see the parts. 5 parts: cardia, fundus, body, and antrum. Among this, cardia is actually esophageal part. Here you can see the parts: fundus, body, pylorus. The medial or right border is lesser curvature 11 cm, and left border is called as greater curvature 25 cm. Anterior superior surface and posterior inferior surface are the two surfaces. Now two openings is there is cardiac opening and pyloric opening. Two sphincter, cardiac sphincter and pyloric sphincter. Cardiac sphincter is physiological, whereas pyloric sphincter is anatomical. Now here you can see fundus is always occupied by air, and below that it is occupied by water or solid substance. The sphincter maintains this. This is the diagram one can draw in any exam. Now omentum, lesser omentum, greater omentum, then gastrophrenic ligament, gastrosplenic ligament, and gastrocolic ligament are the ligaments. Bare areas: triangular bare area, linear bare area, and along greater curvature and lesser curvature. Visceral relation: anteriorly liver, spleen, transverse colon, anterior abdominal wall. Now gastric triangle, it's a triangle which is directly related to the anterior abdominal wall. Now here you can see top space is a quadrangular topographical space bounded by lungs, liver, spleen, and costic margin. Then it is topographically important. Posterior relation: stomach bed. It is a recumbent supine position. Posterior inferior surface comes in the relation with the different structures. Here you can see left crus of diaphragm, left suprarenal gland, left kidney, tortuous splenic vessel, tail of pancreas, transverse colon. Interior of stomach, it has got some gastric rugae, longitudinal and vertical folds, and there are you can see gastric canal. Interior is rosy pink, honeycomb like appearance. Temporary mucous folds are there, longitudinal, horizontal folds. This is the structure of a gastric pit. Here you can see gastric pits, and there are different cells. It has got mainly classified into according to region: fundic glands, cardiac glands, and pyloric glands. All of them contains gymogenic cell, oxyntic cell, and mucigenic cell, but in different ratio. Now coming to the different types of cells in glands. Here you can see surface mucous cell, mucous neck cell, parietal cell, chief cell, G cell, then gastric glands, then gastric pits. Apart from this, oxyntic cell and mucigenic cell and gymogenic cells are there. Here you can see pit cells, T cells, G cell, that is goblet cell, tuft cell, neck cell, parietal cell. The arrow mark is for catalyst and the T mark is for inhibitors. Now this is carbonic anhydride situated in oxyntic cell, which catalyze the direction to form H2CO3 weak acid, and gymogenic cell, you can see H plus ion formed by oxyntic cell activate the pepsinogen into pepsin. This is arterial supply. right and left gastric artery, right and left gastroepiploic artery, and short gastric artery. These are the arteries supplies corresponding veins for venous drainage of the stomach. So this is the venous drainage. Now coming to the lymphatic drainage. Most of the lymphatic drainage from the stomach reaches the celiac nodes after passing through intermediary nodes. The lymph from the gastric wall drains into lymphatic vessels that arises from mucosa. This is here you can see from either side lesser curvature and greater curvature. The lymphatics are connected, and this is a formation of lymphatic drainage. You can draw in exam. Now next, nerve supply. It is autonomous nervous system is by uh, vagus nerve, and sympathetic nerve supply arises from T6 to T9 spinal cord segments and passes to the celiac ganglion. Then stomach intervenes by this parasympathetic by vagus nerve, 90% fiber of vagal trunk afferent into transmitting to stomach CNS. Sympathetic intervention of stomach. Now this is histology. Here you can see mucous layer having surface epithelium, lamina propria, and muscularis mucosa. Then there is submucosa, triangular shaped submucosa you can see here. Then muscle layer contains three muscles. Now applied gastritis, gastralgia, gastric ulcer, cancer of stomach, gastrostomy, hiatus hernia, pyloric stenosis. Peptic ulcer is acid pepsin autodigestion of the stomach. It may be two types, gastric ulcer or duodenal ulcer. Stress, night watching, antibiotics, these are the factors increases vagus irritation followed by over acid secretion which leads to peptic ulcer. Now yes, seeing H plus receptor or proton blocker, these are the medicines used: ranitidine, H plus receptor, omeprazole, pantoprazole, rabeprazole are proton blocker. One of the surgical methods we do for hyperacidity. Thus we cut the stimulation for acid secretion by oxyntic cell. Biopsy urase test is done to identify Helicobacterium pylori. Here an abdominal sample is reacted with the kit, and if the color changes then Helicobacterium pylori is present. This is a teapot stomach in stenosis around lesser curvature. You can see this kind of teapot stomach. This is at greater curvature if there is any stricture, hourglass contraction is formed. So thank you.